Hi, I'm Dr. Josh, and you're going to want to watch this episode I just did with Dr. Eleanor Stein, which where we talk about what is Alzheimer's disease and simple tips on how to prevent it and reverse it if you find that you have Alzheimer's or dementia. So some of those include focusing on sleep and removing toxins. So you're not going to want to miss this episode of the Dr. Eleanor Stein podcast. Peace and plants.
Welcome to the Dr. Eleanor Stein podcast. In this show, you will hear expert medical professionals, researchers, and people with lived experience share science-based, low to no cost strategies to help people with complex chronic diseases. Listen in for another dose of education, empowerment, and hope. I'm Dr. Ellie Stein with a warm welcome to the Dr. Eleanor Stein podcast. In this episode, I talk with Dr. Joshua Helman, who's going to talk to us about some really revolutionary ideas about dementia and Alzheimer's disease in particular. Now, this topic is of special interest to the complex chronic disease community. 85% of people with myalgic encephalomyelitis, chronic fatigue syndrome, fibromyalgia, and now long COVID have complaints of something called brain fog. Now, brain fog is usually defined as trouble concentrating, remembering things, and tracking, remembering one thing while you're doing another. If I had $1 for every time someone in the community has asked me whether I think they have dementia, I would be a very wealthy person. Now, I have been reading in the long COVID community that some people are really worried that this brain fog is going to evolve into dementia. In my own experience, and I've been in the field now for over 25 years, I have not found that to be the case. I don't have evidence to prove it, but I'm just putting it out there, maybe to put some of your minds at rest, so that you can sit back and relax and listen to my conversation with Dr. Helman without undue worry. I've been following many, many people now for decades, and I have not noticed a real surge in dementia. Nevertheless, the cognitive symptoms we experience are often disabling and concerning. Because so many people in the community have cognitive problems, I've taken a keen interest in this topic for years. And when people ask me about dementia, I've wanted to be able to give them some answers more than what they get with conventional medicine, which is that there's nothing we can do. Some of you who've been following me for a while know that I got very excited back in 2017 when I was exposed to the work of Dr. Dale Bredesen. I read his book, The End of Alzheimer's, and I even traveled to California to take a course that he was offering through the Institute of Functional Medicine. I had been taught that there was nothing you could do, and he gives a very different outlook, very different approach. I've been looking ever since that time for someone who is in the field working with patients who can provide an update to Dr. Bredesen's work, and that's what you have the pleasure of listening to today. So I was online, and into my feed fell a podcast with Dr. Joshua Helman. I loved how he presented this new way of looking at dementia really clearly and accessibly. Dr. Joshua Helman has one of the most impressive resumes or curricula vitae that I've seen in a long time. He's a Harvard-trained physician focusing on preventing and reversing Alzheimer's. That's what he does in his clinical practice. He has 2 degrees in biochemistry from Harvard and from Cambridge University in the UK. His dual medical degree is from Harvard and MIT, and he's board certified by both the American Board of Emergency Medicine and the American Board of Lifestyle Medicine. In addition to all of this, he has training in neurotoxicology, Lyme disease, petrochemical and mold toxicity, all things that can potentially drive a degenerative process. So, Dr. Helman, welcome to the podcast.
Thanks, Ellie, and thanks for such a warm introduction too.
Yeah, well, it's pretty impressive. I wonder if you can share, like you've done, I've read a little bit more about your bio, and you've done a lot of things over, I guess, the last 20 plus years. How did you get interested in this particular topic?
Oh, it's interesting. Actually, the interest goes back to when I was a teenager. My
Oh, okay.
grandmother, my grandmother Eileen got Alzheimer's, and so
Ah,
I saw how it affected not just her, but my parents' generation, because they're thinking, wait, this is happening to Grandma Eileen now. What's going to happen to us in 20 or 30 years?
hmm
So, and as a teenager, I'll admit it, I was a nerd. I was studying biochemistry. And the cool thing is what I studied as a teenager and all the degrees I got in biochemistry have actually come in handy now, many, many decades later, that the core concepts, the core biochemistry. Sure, we've definitely learned some things in the last 30, 40 years, but the
hmm
core concepts have not changed. And that's I think that's how I've been able to understand this field and get into it and help people reverse Alzheimer's. But as you mentioned, I actually fell into it in a clinic that was working on dementia where the root causes were often mold toxicity, Lyme disease, and other infections.
Okay. Um, so I want to start at the very beginning because I'm sure you get this question as well commonly, like what is dementia and what is Alzheimer's, and are they the same or different? So maybe if you can just set the stage so that as we talk about more of the details, people will know what we're talking about.
Sure. So to my mind, dementia is a umbrella term that just refers to when your brain stops working, and there are many causes. It just so happens in adults, the most common cause of dementia turns out to be Alzheimer's. About
Okay.
70% of the cases of dementia are Alzheimer's, but there are other causes of dementia. For example, you could have a stroke that will cause you not your brain part of your brain not to work correctly, and that's a form of dementia but not necessarily Alzheimer's. Another example would be trauma. You can
hmm
have head trauma, again, not normally Alzheimer's, although you can definitely see cases of Alzheimer's where there's history of head trauma. So, but
Right.
when I'm lecturing to the general public, I often use the two terms interchangeably. They're not the same.
Okay.
Or for example, brain cancer, or tumors in the brain. That's another example of dementia, and that's not Alzheimer's. And frankly, that's why, because I will see patients who have seen no one else and will turn to me first. I insist that we get some type of brain scan because I don't want to miss tumors in the brain or a blood clot or something like that that's treatable, but you actually have to know about it in order to
Right.
treat it.
So that's a really good point. We want people, if they are concerned they have if that their brain's not working the way they should to really get it checked out. Like this isn't a DIY situation, right? You don't want to be guessing. You really want to know what's going on.
100%. And what I'd also caution people, or it's very interesting, the brain is not responsible just for memory and processing. It also processes emotions. So often one of the early signs of Alzheimer's or dementia can be changes in people's behavior or emotions.
And
But
that's
but
actually leading right into the next question is for anyone who's worried or is worried about a loved one, what kind of things should they look for?
yeah. So the key is you're looking for changes.
Okay.
And to be clear, so we're looking for changes in memory. I mean, as an example, we all of us from time to time might forget where we put our keys, but if this is happening many times a day and that's not your normal routine, that's concerning. Yet the same thing is we all have emotional ups and downs, but if you're noticing more changes, then that's one of the things you would look at. But I'm not saying all emotional change are
hmm
caused by dementia. I'm not saying that at all. I'm saying that's one of the things you would be looking for. Another common one is repetition, where people, every 5 minutes they'll say, "Where am I? Why am I here?"
Yeah.
That's definitely a sign.
And would you also say changes in personality, like people just start acting differently than their normal selves?
100%.
Yeah,
But as an example, I'm sure you've seen this in your clinical work. Something as simple as a bladder infection can cause
right.
changes in behavior, and I wouldn't call a bladder infection Alzheimer's, but it should set you on the path of looking if there's a change. And it's interesting that I often will find that the patient this is happening to is in denial. But the family's like, no, 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 there's
Mm.
something wrong here. And I would encourage anyone who's watching, if they're seeing changes in themselves or someone else, definitely seek help because there is going to be an effect, but there's so much more you can do if you start looking at this earlier.
And this is going to be a little bit tricky because you live in the US and I live in Canada, and our healthcare systems are very different. But what kind of tests or assessment would you recommend for someone who is concerned?
Yeah, so the first thing is, as I mentioned, I would recommend some type of brain scan, either a CAT scan or MRI of the brain to look for, are there structural changes, tumors, blood clots,
Mhm.
etc., that would attribute these changes in behavior or memory or processing. So that's the first thing I would do. And then the next thing I would do is simple blood tests, a complete blood count, a complete chemistry test to make sure that we're not looking at something like kidney failure or severe anemia or things like that.
Yeah,
And
thyroid or
sure.
yeah.
And then if nothing checks out, if all those tests are normal, then I would start looking at some of the more functional tests. Do you have high levels of mold or other
Mm.
toxins, heavy metals, or infections like Lyme disease, Bartonella, parasites? I would be looking for all those things. And um, I know I've seen a lot of Canadian patients come down to the United
Okay.
States for treatment, and often by the time I see them, they've seen dozens of other experts and doctors, and often I'm, you know, the last resort, or so often I'll have a patient who has, literally their chart is like a book, uh, but it's
Yeah.
okay if that's not the case. That you have to start with where you are.
And is there any kind of cognitive or what they would call psychometric tests that you would recommend? Like I know in Canada, it's pretty hard to get an in-depth neuropsych assessment, like really hard to get. But is there something maybe that would be more accessible that you would recommend?
Certainly. Yeah. So you're exactly right. Like a formal neuropsych testing can take 7 or 8 hours, and I'm not opposed to people doing that, but I would start with something simpler. The test I normally get is called CNS vital signs. There's a
Mm,
company called CNS, but there are other computer tests that you can do that will take anywhere from 15 minutes to an hour. And
okay.
and it will evaluate different parts uh of your frontal lobe in terms of remembering words, processing speed,
Mm,
and things like that. And I would recommend if you're noticing a change in memory, get a test like that. You don't necessarily need the 8 hour test to start with. There are straightforward computer tests that can actually give lots of good information.
yeah, I used the CNS vital signs in my practice for 20 years. I found it really helpful, especially to track people over time, right? So I'd say come in and do it now, come back in 6 months. If it hasn't changed, then it's probably not dementia, right? So could put a
Right.
lot of people's minds at ease.
And I think that's important because I can have someone who, say, has a college degree or a graduate degree, so highly intelligent, well-trained brain. And if I give them a simple 5 minute test, they may pass it completely,
Hmm.
but you could tell there's something not right. And that's why I like a test like CNS vital signs to help tease that out. And you're right, it's great to have historical data and say, look, you're actually getting better or you're getting worse in these areas.
So I'm going to dive right in. What leads you, the rest of the time that we're going to talk together is about how to stop or even reverse dementia. So that's almost heresy. Like that's not talked about still anywhere in long term. I have a little story. So after I learned all about Dr. Bredesen's work, I went to my local Alzheimer's Society thinking, oh my gosh, they're going to be so excited to learn about this. And I'm going to, do a talk for them and like change everything, right? Because not nowhere on their messaging was anything about improvement. And they were not interested whatsoever. So the mainstream medicine and the mainstream, I don't know, nonprofit world, I don't think they're on this train yet. But that's why I wanted to bring you to talk to people directly so they can hear, A, there is hope. And my question is, what leads you to be able to say this with confidence? Like, what's the evidence, both from the research and I guess from your clinical practice, that you can come, on a platform like this and say, there is hope. You can slow, stop, and even reverse dementia.
Yeah, Ellie, you're exactly right. There is hope. And, the transition. So when I was at Harvard Med School, say 35 years ago, I was taught that Alzheimer's, you can actually only make the formal diagnosis after death. At autopsy, you would actually look at brain tissue under the microscope and say, oh, yeah, this was Alzheimer's. And yeah, there were really, at the time, there really wasn't much you could do. This was many decades ago. Fortunately, there are many things you can do, but you're exactly right, most doctors have not caught up with, and they're not like Dr. Brednison seeking the latest and the greatest to reverse Alzheimer's. I will say it because I've done it many times over the last 6 years for 100 patients or more. So this is not
Mhm.
theoretical, but it's not just me saying it. There was a journal article published last year by Dean Ornish in one of the Alzheimer's journals showing that in 20 weeks, mild Alzheimer's was reversible just with lifestyle changes. This was a
Wow.
randomized control study. So it's not just anecdotal reports like people like me. And that's why I love journal articles that actually show this. In just 20 weeks, you can start reversing Alzheimer's just with lifestyle.
And what does lifestyle mean? So, sometimes I'm all about lifestyle for, the
Okay.
people watching who are part of my community. But I think sometimes there is also a segment of the complex chronic disease community that thinks lifestyle isn't very fancy, sexy, powerful, and they're waiting for some fancy drug to come to cure them. And I think it's the same in the dementia world. People are waiting for the big drug that's going to turn it all around. And maybe explain why that may not be like it's unlikely in my read that one drug is going to change everything because it's so multifactorial.
Right, you're exactly right. So it turns out from doing the machine learning AI analysis of many different cases of Alzheimer's, you're dealing with between 30 and 200 root causes.
Wow.
And because you're dealing with so many different root causes, you're exactly right. I don't think we're going to find a magic drug that's going to fix 200 different things. I wish we could, but I I haven't seen that historically, and I don't think we're going to see that. So that's number one. Number two, lifestyle are things like exercising, eating the right things, decreasing stress, forming a community, making sure you get enough sleep. And you're exactly right. That's not exciting. Big companies can't make lots of money telling people to get 8 hours of sleep and make sure your deep sleep is good. And I think that's why there's some inertia. I think the other is, and it's not just physicians. I see this laziness in many different professional fields where the attitude is, I spend, 10, 15 years learning this field. And once I've learned my profession, I'm going to go out there and I'm just going to do it. I don't have time to look for the latest and the greatest. And
Hmm.
I think it's a sad commentary, but I think it's also human inertia. I mean, we're designed not to extend extra energy, and And I haven't been that way. I've been very curious from a teenager on, and so I've been staying up late at night, looking for these solutions, and that's how I found Dale Bredesen and to me that's a good place to start. Um, yeah.
Yeah, so maybe I'm just because there's a lot of them, so maybe dive into what are, what of the list of root causes, what would you put at the very top?
Wow, there's so many. I would say if you look though at the machine learning, the biggest risk factor turns out to be not enough N3 deep sleep.
Okay,
And so someone may get 8 hours of sleep a night, but unfortunately they never get to the deep sleep. Deep sleep is where your brain is able to consolidate memories and clear out the amyloid plaque. So,
right.
I, if you had to pick one, I would say sleep. Number two is I would say inflammation tends to be one of the root causes behind a lot of, or many of the cases of Alzheimer's. But as you know, there's so many things that can cause inflammation. We're talking about toxins, infections, and then I would also put high up there would be insulin resistance, too much sugar, and then we have head trauma, and then genetics. Genetics is really important
Hmm.
because, and it's not just the ApoE4 allele we're worried about. The cool thing is we're learning more and more that this field is taking off exponentially of other genes that will put you at increased risk or decreased risk. And what I would tell people is don't be afraid of genetic testing. I'm a big advocate because if you find out that you have one of these genes, the cool thing is the research is showing that if you adopt the right lifestyle and take other approaches, that you're actually able to um, not have any more risk of Alzheimer's than if you didn't have this bad gene. So the cool thing is that these genetics can be overcome with lifestyle and other approaches.
I just want to really kind of emphasize what you just said or make sure I heard you correctly. Because again, I grew up learning that if you had ApoE4, so that's a certain variant of a gene that determines kind of how we manage fat, I guess, basically, um, that it's, especially if you have two copies of it, right? So both copies, because we have two copies of every gene,
Right.
one from our mother, one from our father, that it was pretty much a death sentence. So you're saying that's no longer the case.
That's exactly what I'm saying. Is that
Okay.
if let's say you had a ApoE44, that if you adopt the right habits, getting enough deep sleep, exercising consistently, decreasing your stress, etc., that you will no longer have excess risk. That it's modifiable. So
Wow.
so that's the point. I think that's why people should be focused on this. But this is a different approach. I'm not talking about a drug here, although I am using an FDA approved drug for compassionate use and other advanced techniques. So I'm not opposed to drugs. But my
Hmm.
point is that the easiest and the most effective often are just changing your lifestyle. And I know we're in Western society, we're addicted to our salt, oil, and sugar, processed foods, and their big financial push in the media, etc. Not for people not to change those habits, but I'm saying for our own health, specifically our brain health, you do want to cut out processed foods and things like that.
Can you say why? So let's dive
Sure.
in, to what these lifestyle factors are. And of course, I want to get back to sleep because that's so critical. But you've just gone into food. So why is processed food so problematic? Like a lot of people hear that it's very common knowledge, and yet I don't think we really take it to heart. We don't, and maybe it's because we don't really understand, well, why is it such a problem?
Yeah, so it's a problem for two different things. So actually the processed foods are toxic because they have high levels of added salt, oil, and sugar. And we now know those three substances do damage to our blood vessels. And you can imagine the brain being a very vascular organ. If you do damage to your blood vessels, there's going to be damage within the brain and to the blood vessels, say the carotids, leading blood from the heart to the brain. So again, the first problem with processed foods are the added salts, oils, and sugars that are causing the blood vessel damage. So that's number one. But number two, the other issue is if you're spending most of your time eating the the fast food, the processed foods, you are losing what's called an opportunity cost to eat real nutrition, real antioxidants, and fiber. It turns out that having fiber in the diet is key from fruits, vegetables, grains, is key for a healthy gut bacteria, the microbiome, and in turn for a healthy brain. So it's not just that the processed foods are toxic, but if you spend most of your time eating that, that's going to crowd out real nutrition that we were designed to eat to help our brains.
So how, like, I can kind of hear some people maybe thinking to themselves, how much do I have to stick to, say, the good diet? Is it like you hear some people say it's all or nothing. Some people say, well, 80/20 is okay if you eat the healthy foods 80% of the time for the sake of keeping you on the program, because if you try to be perfect, you're probably going to fall off the wagon. So where do you kind of fall on just how much do people need to adhere to what I'm going to call a colorful, ideally organic, real food diet?
Yeah, so that's a hard question to answer because I mean, I know my own history. This was a dozen years ago. It took me many years to transform to eating fast food, junk food,
Yeah,
to mainly eating whole plants and avoiding added salt, oil, and sugar. I'm not perfect, and I don't expect anyone else to be, but it's really hard to put a number. But if I've got someone with brain problems, with dementia, I'm going to encourage them to do as much as possible. But
right.
I understand we live in a society where what I'm talking about is not mainstream, and one of the things that we're designed to do is to socialize, have a community. And the reality is, if you go to a community event and they're serving all these processed foods that are not good for us, if you say thanks but no thanks, I mean, I guess you can
It's
say
hard. It's hard.
it's difficult,
Yeah.
and you can say, "Oh, this is what my doctor recommended." So I always tell people, "Sure, blame it on me.
Yeah.
I'm okay with that." But it is hard, and what I would encourage people to do is find their own community. But exactly right, it is difficult. So I wouldn't tell people they have to be 100%, but what I would say is that your body is always watching. Even on your birthday, if you're eating garbage, yeah, that is going to have effect on your cells, unfortunately. Now, what one day out of the year, no, I think the cool thing is your body will be able to recover. But I don't know about you, but I find that if I cheat and eat highly
Oh,
processed foods, I don't feel good afterwards. So, it might be 5 minutes of pleasure and then like I don't feel good for many hours. So,
yeah.
we learn, our body learns, and our body gives us feedback. Definitely listen to it.
So this, I'm going to bring up a controversial question. In my community, I'm a big promoter of eating animal protein because it seems like, for, complicated reasons I won't go into, it seems to be helpful. I know you just mentioned mostly plant-based. So do you have a opinion about so you're eating kind of real whole foods, but kind of how much of them should be plant-based versus animal-based?
Yeah, so again, you're right. This is controversial, but the way I read the literature and also treating patients for decades, what I've seen is that if you're eating animal foods, animals have, in general, about 10 times higher levels of toxins than
Ah, I see.
plants.
Okay.
So now I definitely have taken care of patients who, because of, say, bad mold toxicity in their gut, that there was almost nothing they could absorb through their gut, and maybe a few animal products. So I'm not saying everything here is absolute, but what I am
Hmm.
saying, what I've seen is if you're eating animal products, you're going to get much higher levels of toxins, which in turn will cause increased inflammation. And again, what I've said is, and what I found is, one of the common root causes of brain disorder is inflammation. So by cutting out animal products or limiting them as much as possible, you're turning down, say, the amount of endotoxins,
Yeah.
which are the cell wall of bacteria. And guess what? If you're eating animal products, animals are not raised in sterile environments. They have bacteria in their own guts. And if you're eating their flesh, you're going to end up with much higher levels of endotoxins like LPS, lipopolysaccharide, which we know is one of the key stimulants of your immune system.
And maybe a last diet question. Where do you fall on the low fat, low carb? I guess if you're eating mostly plants, you're more in the low fat
Well,
side of that spectrum, or
well, I, I there are people out there who eat plants, say avocado, that are high fat.
right?
So not all plants are are low fat, but in general, plants are definitely lower fat than animal products. So you're exactly right. I normally recommend a low fat plant based diet.
Okay.
The more the better. I I understand the keto approach, and to my mind, the ideal way to go ketotic is to do a water fast. I worked in a fasting center, True
Mm,
North, for years, and within a few days of water fasting, you have very high ketones. But in general, I don't like people, and again, this is controversial. I know,
yeah. It's
Dale Brett.
opinion,
Yeah,
almost opinion at this point, but I'm just curious,
sure.
how you guide your patients.
Yeah, so I know Dale Bredesen is all about the keto approach. I'm not that way
Okay.
because I find if people are long term on on a ketogenic diet, it's very hard on the liver, on the kidneys, etc. So
Okay.
but I do agree with Dr. Bredesen that your last meal should be, say, 3 hours or more before you go to sleep. So I'm a big fan, say, of intermittent fasting, where you have a
Hmm.
limited fasting window, or I'm sorry, a limited eating window. Say you skip breakfast and you eat from noon until 6 p.m. You got a 6 hour feeding window. I'm a big fan of that. So you're right. There's definitely different opinions out there, but again, the way I read the literature, plants are the way to go. And but also when fasting, whether it's water fasting for many days or just intermittent fasting, having a limited feeding window. What's really cool biochemically, if you look at how cells respond, fasting is almost identical to exercise in terms
Mm,
of that, the biochemical response of the cells in your body.
right. And it turns on good things that help the lymphatics empty the beta amyloid out of the brain. And
Yeah,
yeah,
you get more BDNF, brain-derived neurotrophic growth factor, which stimulates neuron growth and nerve connection synapses.
right. So it helps turn on neuroplasticity.
Yeah.
Yeah. Can we move to sleep? So, in my community, a lot of people, like I talk endlessly about sleep and CBTI strategies and waking up at the same time every morning. And nevertheless, some people do a lot of those things and still don't have refreshing sleep. I was just wondering, what are your tips on trying to get that so valuable deep sleep, N3 sleep?
Yeah, so the first thing I would say is if you're worried about your sleep, get a formal sleep study.
Mm,
It's that way you'll actually know. I mean, there are devices like the Apple Watch and the Aura Ring that are good, but unfortunately, they're not good, validated approaches to knowing how much of that N3 deep sleep you're getting. So, some of my favorite tips are I'm a fan of melatonin uh,
okay.
before going to sleep. My favorite source turns out to be pistachio nuts. Of just a few pistachio nuts are high in melatonin. So
Oh,
that's
okay. So not taking a supplement, but having food that contains melatonin.
right. Right.
Okay.
So,
Hmm.
because it used to be years ago, and it's gotten a little bit better now, but 10 years ago, you would go to the store and buy something that said, oh, this has melatonin. But when you analyze it, there actually might be no melatonin in there, or there could be way too much.
Yeah.
That the industry was just crazy. But I knew if you just had three pistachio nuts, you're going to get a good dose of melatonin. So, so I like that. I like lavender essential oil.
Hmm.
I like Lang Lang essential oils.
Don't know that one.
Okay. Yeah, Lang Lang is just a flower, but it happens to have natural substances, terpenes in them that are calming, promote GABA in the brain.
Okay.
So, and I personally, I'll use doTERRA and put a couple drops under the tongue, but there are other ways to take it. I'm also a fan of supplements like magnesium and taurine.
Hmm.
Those can be very calming and relaxing.
Okay. So I'm hearing you recommend a number of supplements, but I'm not hearing you recommend medication for sleep.
Correct. Now, you're exactly right. There are some medicate. I mean, there are some people. We've tried everything. I'm a fan of New Calm, which is certain type of music you listen to.
Mm,
To me, medications would be the last resort. Now, there's certain patients I'm treating. They do need prescription medications. The problem is many of the prescription medications long term end up doing promoting Alzheimer's and dementia. As an example, that would be um, sleep medicine.
like the anticholinergics
Yeah,
and
yeah, like Benadryl.
antihistamines.
But
Yeah.
people might just take Benadryl every night to get to sleep, and the problem is it, as you said, it's anticholinergic. It decreases the amount of acetylcholine in the brain, and it turns out acetylcholine is one of the most common neurotransmitters in the brain. So if you're turning down the amount of acetylcholine, you're actually harming long-term brain function. So just to be clear, I'm not saying never take Benadryl if you've got
Yeah.
allergies. I'm just saying you don't want to take it every night as a ritual to get to sleep.
Of the kind of lifestyle sleep strategies, what's your go-to, like first thing to try if your sleep is really messed up?
Yeah, so one th definitely exercise. It turns
Hmm.
out when you exercise during the day, your body is more it needs more recovery. That can promote sleep. Another trick that I found is that if you heat up your body right before you want to go sleep, it helps. Whether you're getting into a hot shower or into a sauna, what'll happen is you're in this hot environment and your brain will say, wow, I'm in a hot place. I need to turn down my core body temperature. So what happens is you get out of the sauna or the hot shower, hot bath, and all of a sudden your brain is still lowering your core body temperature. It turns out that a low temperature is a trigger to get to sleep. So it's basically a hack right before you go to sleep. Stay in someplace warm for a little
Hmm.
bit, and then when you get out, your body's going to be like, okay, it's time to go to sleep.
Okay. Let's move on to exercise. You mentioned that as another lifestyle modality. Now, in my community, complex chronic disease, a lot of people are pretty limited on how much activity they can do as because of something called post-exertional malaise. So they do some activity and then they really crash and pay for it. So just with that in mind, so I always warn my guests, don't recommend training for a marathon because everyone's going to turn you off. But say people feel that they might be able to do a little bit more activity, how would you recommend they go about it?
Yeah, Ellie, you're exactly right. I've taken care of hundreds of patients with chronic fatigue,
Mm,
and
okay.
I love them. They're amazing patients, and many of them are super driven. They're like, tell me what I need to do, and I'll do it five times better. Or
Yeah.
which
Yeah.
I love that attitude. But exercise is not one of those things because they'll overdo it. Exactly right. If I say, you know walk for 5 minutes, they'll run for an hour, and then I'll spend the next couple of weeks try to clean them up
Yeah.
because So again, what I would say is yes to a little bit of exercise, but go low and go slow. For normal people, it's an amazing thing, but you have to titrate it. You have to go low and slow because what can happen, unfortunately, many of these patients will have biofilm. And when you exercise, but biofilm is this biologic film that
Hmm.
has infections, mold, and other toxins, and the biofilm can be in your brain, in your bloodstream, other tissues in the body. So the challenge is that when you exercise, you're very quickly pumping blood through your heart valves, and the biofilm in the blood can get released. And then within the biofilm can be these heavy metals and other infections,
Okay,
and people can get worse.
got
So it's
it.
a double-edged sword. I would say definitely titrate it, and you definitely also want to be on glutathione, the master detoxifier, to be able to deal with the side effects of of the exercise,
Releasing, yeah.
releasing all these
Wow.
toxins.
So let's go into toxins because that's really an area that you're pretty expert in. And how do you look for them? Again, keeping in mind maybe potential differences in the US and Canadian healthcare systems, that things are a little bit trickier here sometimes to access. Um, are there clues like when you're evaluating a new patient, this person, I think infection or toxin is part of the picture? Like what would, or do they really all look the same and you got to test everybody?
I would say I would test everyone because at least the
Okay.
population I've seen, they're dealing with both toxins and infections. And I understand I'll meet with someone and say, well, let's just look at infections. I don't think I've got toxins. And I will, but, and we'll treat those. But if normally you have to look at both, and
Okay.
it doesn't matter what you want it to be. What I find is that in most cases, in order for your body to have had all these issues, it needs lots of insults,
Yeah.
and it turns out that the infections and the toxins are both. But to your point, and fortunately in Canada, you can also order these tests. My favorite company
Hmm.
turns out to be Vibrant Wellness, and I've got patients from Canada where we order those tests too.
Oh,
But
that's a
spe-
Canadian lab? I haven't
no,
heard of it.
it's a lab that happens to be in Silicon Valley
Oh, okay.
In California. But the cool thing is in most countries around the world, I can order those tests, including
Yeah.
Canada.
Yeah.
Um,
And so
so
can you just maybe even name some of like,
sure,
people don't have unlimited funds, but what would be two or three of the panels? Usually they're in panels, right? Looking for a
sure,
bunch of infections or a bunch of toxins that you
sure.
found the most helpful or actionable, that stuff actually shows up that you can then try to do something about.
Sure. So I would start with their total toxin panel, which includes glyphosate or Roundup. It
Yes.
includes heavy metals. It includes mold toxins, which they call mycotoxins. And these are all urine tests. And it also includes industrial toxins, things like PCBs and DDT and
Okay.
plastics. So I would start with the total toxin panel. I would also add on forever chemicals too.
Okay. And then what about for infection?
For infection, I like Vibrance. Um, uh, it's called, oh wow, it was just on the tip of my tongue. Give me 1 second.
Okay, no problem.
It's called Tick-Borne 2.
Okay.
Tick-Borne
So
2.
looking for tick-borne
Right,
diseases and
right.
co-infections.
But just to make clear, and many of your listeners know this, Lyme and these other infections, parasites are spread not just by ticks, they're spread by mosquitoes and other ways.
Yeah.
So just because you don't remember being bit by a tick doesn't mean you don't have these infections, unfortunately.
Okay. What about viral infections or viral reactivation? Do you find that's a player?
Definitely. Things like CMV and herpes virus, um,
Yeah.
West Nile. I mean, there's so many.
Now you mentioned a couple other Dale Bredesen calls it holes in the roof, right? If you've got a leaky roof, i.e., cognitive challenges, you got to patch all the holes in order to have a dry barn. Um, let's see, you mentioned stress as well, and maybe I'll just open it up if there's other kind of risk areas that you feel people need to look at.
Yeah, I mean, definitely stress is part of it. Most people I see with Alzheimer's, uh, I mean, obviously having Alzheimer's is stressful, but there seems to you can be stressed at work, you can be stressed in the family. The antidote to stress is because you're not going to eliminate all stress in your life, is things like exercise or meditation or listening to music. I mean, I mentioned New Calm, but there's so many
Hmm.
different ways to get calming music. Uh, a prayer. There are.
Hmm.
I mean, we could do a whole episode just on ways to decrease stress. I like chamomile tea, uh, lavender. I mean, there's so many options.
So you're basically saying to people, there's so many ways, but take stress seriously and figure out what works for you.
Yes, and I would also say self-compassion
Mm,
because the journey for people I've seen with chronic fatigue and similar disorders, it's really tough where often the healthcare system itself will say, "Oh, this is all in your head. You're just
yeah,
being lazy. This is all on you." And so you've got the healthcare system often not being supportive. And then the next piece is families. Half your family may be supportive, but the other half may say, "Oh, you're just being lazy. Just snap out of it, go back to the way things were." And no, this is a real issue. My patients with CFS and other conditions like that, they have often high levels of these toxins and infections, the biofilm, et cetera, that show up on the testing. So what I would say is just self-compassion and forgiveness. Forgive yourself and forgive our crazy society that for some reason only recognizes acute Lyme disease but doesn't recognize chronic infection. I have no idea why, but
yeah.
that seems to be the status quo as of today.
So just to kind of wind up this part, once you've assessed people and you've figured out maybe their top 10 risk factors or hole in the roof, is there a certain order that you go about trying to patch these holes or get rid of these root causes? Does it matter? Can you start anywhere?
Now you can start anywhere,
Okay.
but but um, but I would probably start with sleep.
Okay.
Sleep is the first one I would do. But I normally start with whatever data I have. So if I find someone has high levels of heavy metals, then
Hmm.
you focus on detoxifying and fixing those. I think it really depends. And again, I don't want to overwhelm people. Uh,
That's the thing, right? If you got 50 holes in your roof, you could easily get overwhelmed.
Right. And to me, the first approach when it comes to toxins, for example, is is glutathione, protecting people from actually getting worse. And
Yeah.
that's a real issue. I mean, having been in this field for many years, before I knew what I know now, is if you aggressively treat some of these infections and toxins and other things, they can easily get a lot worse. And that's to me that's part of the Hippocratic Oath. I want to make sure I'm not doing any harm. Just like we mentioned, exercise is a good
Yeah.
thing in moderation, but you know, if you get too much, that could definitely set you back.
Maybe just one more risk factor that you haven't mentioned. I'm curious if you've thought about it is EMF, so non-native EMF, right? Wi-Fi, electricity, routers, all of this. Do you give your patients any recommendations on that?
I do, but often they'll come to me. They've
Okay.
already figured out that EMF, that if they're around a smart meter or devices, and many of them will already figure out how to protect their brain. I know my own brother has this. He'll wear like a wool hat that'll
Mm.
he'll that will protect him from some of the EMF. It's interesting, about 20% of the patients I've seen with chronic Lyme or mold will have this extreme sensitivity for EMF. I think it's related to the axonal sheath being damaged.
Oh, okay. I was thinking maybe or blood-brain barrier, but that's interesting.
I would say,
Yeah,
unfortunately, most of my patients don't have an intact blood-brain
right.
barrier. But I've seen this firsthand, where I'll have one patient who's with chronic fatigue who's got seizure disorder, like their arm will start going, and if I put another patient right next to them with similar EMF sensitivity, that other patient then will also start having seizure activity.
Wow.
So it's first of all, it's real. And it's interesting that it affects more some people more than others, but I think all of us should be trying to avoid EMF as much as possible. It's becoming more and more difficult with some of these 5G and
I
other
know.
other electronics. Yeah.
I just want to ask you, you mentioned you gave us this little tantalizing comment right at the beginning. You said there's a new drug that you're using. I've looked it up. It's not available in Canada, so
Right.
just to put that out there, but it still will give hope that for some people this may be a possibility. So can you just share what the drug is, how you're using it, and what you're noticing?
Sure. The name of the drug is TB006, and and you're right. It's approved for compassionate use in the United States only by the FDA. So it's only right now only available in the United States. What it does is it inhibits galectin 3, and galectin 3 is a protein. It's a lectin that we all produce. It's part of our immune system. Unfortunately, in certain chronic diseases, including Alzheimer's, you have much higher levels of this galectin 3.
Mm.
And you and your audience may have heard of lectins. Sure, there are lectins in plants, but this specifically, galectin 3, is manufactured by people, by our immune system, and it's specifically in the brain manufactured by the macrophages that are
Oh, the
normally eat
inflammatory
up.
macrophages.
Yeah, that normally
Yeah.
eat up infection and cancer cells and things like that. So they will actually produce this galectin 3. And so what this is an antibody against galectin 3. What it does is it dissolves the amyloid, turns down the amount of inflammation, and the amyloid plaques go away, and we also
Wow.
get improved cognition after I've seen it after just one dose. It's normally given intravenously once a month for 6 months.
Okay.
So yeah, and I've been seeing great results with it so far, and that's why I'm not opposed to using medications, especially ones that work. The other cool thing is we're not seeing any side effects. Some of the
Wow.
other newer drugs like Leqembi, about a third of the patients you'll see brain swelling, brain bleeding. We're not seeing any of that. So um,
It's
yeah,
really encouraging.
it definitely is. Another cutting edge technology I would recommend, going back to toxins, is something called total plasma exchange, where you take out blood from one arm, and then in the other arm you put in albumin, human albumin protein. So by taking the blood out of the arm, any of the toxins in the arm end up going away. So that's there are studies now, something called the AMBAR study, showing that with 6 of these total plasma exchange, 6 sessions, you can remove the toxins and improve the dementia, the Alzheimer's.
Oh, that's really exciting because I mean, I'm sure many of the listeners know billions, right, has been spent on dementia research. So many drugs have been tried, and we don't have a lot to show for it. So, really encouraging. There might be some things just around the corner.
Yeah, 100%. So the best is to try to get this, galectin 3 inhibitor, but another drug I'll put out there, it's actually not a drug, it's a supplement that's been on the market for over 20 years. is called pectosol.
Hmm,
Pectosol binds heavy metals, and it also has been shown to decrease the amount of galectin 3.
very
So,
interesting because I've come across that for sure. So just to wrap up, people are going to want to know how to reach you, and they're going to want to know whether you accept patients from Canada or other countries. So
right.
maybe start there.
Sure. So, yes, I do accept patients from around the world, including Canada. And you can reach me. Probably the easiest way is my website, which is just Dr. Josh, drjosh.com.
Okay.
And my email address is just drjosh, drjosh at drjosh.com. And then you can also find me on social media under Green Brains MD. And I also have a weekly podcast on reversing Alzheimer's called Alzheimer's Breakthrough with Dr. Josh. And that's available on Spotify and Apple Music. And I'm also on YouTube. So wherever you want to get your podcasts. So yes,
Okay.
you can reach me all those places.
And so maybe just to sum up, what are your top three tips? If someone is worried about themselves or someone else, what are the things they should do first?
Sure. So the first thing is make sure you've got the right diagnosis.
Right.
Right. So, and don't be afraid to seek help because there's
Yeah.
so much more you can do the earlier you catch this. Normally Alzheimer's can take 30 years to develop, but the first 20 years you may not be symptomatic. So I would say definitely seek help early. That's number one. Number two would be focus on your sleep. For if you find you do have the diagnosis of Alzheimer's, focus on getting deep N3 sleep.
Hmm.
And we've got there's this new device we didn't even talk about, a sleep mat that I've seen
Mm,
tremendous improvement of people's N3 sleep. And
okay.
if you want more information on that, you can reach out to me. And then the third is I would focus on trying to decrease inflammation, yeah,
Okay.
by um, glutathione and lots of other approaches.
Great. Thank you so much. I really, really appreciate your time. I'm going to connect with you, Dr. Josh, and ask for some of those links and papers and references, and we'll
Sure.
put them in the show notes so people can
Awesome.
easily find them.
Awesome.
So thank you so much. This
Thank,
was extremely hopeful and useful.
thanks, Ali. Great questions. And yeah, I love what you've been doing for years and you keep it up.
Thanks. Thanks for joining me on the Dr. Eleanor Stein podcast. I hope you are taking away new strategies and ideas to improve your health and a renewed sense of hope. Join me, Dr. Eleanor Stein, for our next episode. Can't wait? Check out my website for a wealth of free resources.